Hello, and welcome to today's daily psychiatry study session. I'm so glad you're here, carving out these few minutes to deepen your understanding of the human mind. Every time you show up for one of these sessions, you're strengthening your knowledge and your confidence. You're doing something meaningful, and that's worth celebrating. Let's begin with open curiosity and a gentle, supportive mindset. You've got everything you need to absorb today's material. Today, we're focusing on major depressive disorder, one of the most prevalent mood disorders encountered in clinical practice. Let's explore three key points that will help solidify your grasp of this condition. First key point, the diagnostic criteria and the SIGECAPS mnemonic. To meet criteria for a major depressive episode, a person must experience at least 5 symptoms nearly every day for at least 2 weeks, with at least one of the symptoms being either depressed mood or markedly diminished interest or pleasure in almost all activities. The classic mnemonic SIGECAPS helps us remember the core symptoms: sleep disturbance, insomnia or hypersomnia, interest loss, anhedonia, guilt or feelings of worthlessness, energy loss or fatigue, concentration difficulty or indecisiveness, appetite or weight change, psychomotor agitation or retardation, and suicidal thoughts or morbidity preoccupation. These symptoms must cause clinically significant distress or impairment and cannot be attributable to substances or another medical condition. A helpful clinical pearl: always screen for manic or hypomanic symptoms to rule out bipolar disorder, because misdiagnosing bipolar as unipolar depression can lead to ineffective or even harmful treatment. Second key point, common specifiers, course, and comorbidities. Major depressive disorder isn't a single presentation. It can vary widely. Important specifiers include melancholic features, profound anhedonia, early morning awakening, psychomotor disturbance; atypical features, mood reactivity, hypersomnia, heavy leaden feeling in limbs, interpersonal rejection sensitivity, and anxious distress, which carries higher suicide risk. The course can be single episode or recurrent. Recurrent episodes are common, with about 60% of people who have one episode experiencing another. Comorbidity is the rule rather than the exception. Anxiety disorders co-occur in roughly half of cases, substance use disorders are frequent, and medical conditions like chronic pain or thyroid disease can complicate both presentation and treatment. A useful reminder: persistent depressive disorder, dysthymia, involves milder but chronic symptoms for at least 2 years, while double depression describes dysthymia with superimposed major depressive episodes. Third key point, foundational treatment principles. Treatment is multimodal and individualized. First-line pharmacotherapy typically involves selective serotonin reuptake inhibitors, SSRIs, such as sertraline, escitalopram, or fluoxetine, valued for efficacy and tolerability. Serotonin norepinephrine reuptake inhibitors, SNRIs, like duloxetine or venlafaxine, are common alternatives, especially when energy or pain symptoms predominate. Psychotherapy is equally important. Cognitive behavioral therapy, CBT, helps patients identify and restructure negative thought patterns, while interpersonal therapy, IPT, focuses on improving relationships and role transitions. Behavioral activation, a core component of several therapies, encourages engagement in rewarding activities despite low motivation. For treatment-resistant cases, strategies include switching agents, augmentation, for example, with atypical antipsychotics or lithium, or neuromodulation approaches like ECT in severe or psychotic depression. Always assess suicide risk thoroughly and consider hospitalization when safety is a concern. Recovery is the expectation with adequate treatment. About 2/3 of patients achieve remission with optimized care. You've just covered essential, high-yield information about major depressive disorder. Take a quiet moment to let it settle. Maybe silently recall the SIGECAPS symptoms or think of one clinical pearl that resonated. These small moments of reflection are how knowledge becomes intuitive. You're building real mastery, step by step, and that's incredibly powerful. Be proud of the effort you put in today. Tomorrow brings another focused session. Until then, carry this learning with confidence. You're doing wonderfully. See you soon. Word count 752.